Good morning. I'm Jeanette Millin Young, your senator, your voice, your advocate in the 29th legislature. 1 year ago to the day, I spoke with you on this broadcast forum about my first piece of legislation, a bill to create more summer employment opportunities for our young people. And I spoke about the opposition that the measure was facing from administration officials. I also said on that day, a year ago, that I did not and would not support an increase in gross receipt taxes because I thought, and still do, that it would be a regressive move for our economy. In the year that has passed, much has changed and much has remained the same. As I did a year ago, I am still coming before you to discuss my legislative initiatives, and unfortunately, I must report that they are opposed by the administration as vigorously and consistently as my first bill was. Today, I come before you again to discuss another piece of legislation that I have sponsored and have been pushing for months, Bill number 29-0198, to create a comprehensive crime and public health task force. This legislation addresses two basic facts that we can all agree on. One, we are beset by a wave of violent crime that threatens to erode the very fabric of our community unless we take bold steps to address it. Second, our various government agencies don't do enough in the areas of collecting, analyzing, and sharing the data we need to make intelligent policy decisions. Under this bill, various agencies led by the Department of Police and Health will come together to collaborate and provide the Senate with data that will allow us to determine the true cost of violent crime in the territory and to develop policy initiatives that address crime and public health issues in the most effective and cost-efficient manner. For example, we know that from 2004 to 2011, the Schneider Regional Medical Center has spent almost $13.4 million, most of which was uncompensated, to treat the victims of gunshots, rapes, stabbings, and other assaults, including domestic violence. However, we have a few facts and figures regarding some of the indirect but very significant costs of violent crime in our community. Do you know, for example, that research done in many jurisdictions has demonstrated many of the health issues that plague our community, such as stress, obesity, cardiovascular disease, and diabetes are also related to the incidence of violent crime? Think about it for a moment. In communities facing high rates of violence, people are less likely to engage in outdoor activities and exercise, and the levels of emotional stress are much higher. Similarly, it has been shown that many initiatives which may seem unrelated to law enforcement actually have a significant impact in reducing crime. For example, a program called Ceasefire, developed by the University of Chicago's School of Public Health, has achieved significant reductions in violence in the areas of the city where it operates. And the model has been adopted by the city of Baltimore, which also has seen very good results. In addition, the University of Pennsylvania recently completed a 10-year study in the city of Philadelphia, where it was found that the simple act of transforming abandoned lots into green space lowered crime rates and improved public health in communities across the city. Why is this so important to know? By knowing what works and by evaluating the cost and effectiveness of various solutions, we can make policy based on real data and not only save hundreds of lives, but millions of dollars each year. Unfortunately, however, some officials are saying that they cannot carry out this work unless the legislature appropriates funds for them to do so. I strongly disagree and can cite numerous examples of task forces and commissions created by the governor and the legislature without appropriations. There are many which provide monies only for travel, which this bill avoids by specifically mandating that the task force must use free internet-based teleconference tools to avoid the necessity of travel. Secondly, much of the data collection and analysis that we expect from the task force are things that the various agencies should already be doing, and I can't see where there is a cost for collaboration, particularly when it will lead to cost savings. However, as I stated earlier this week, I'm not willing to take the risk that this legislation will not pass due to the excuse of a lack of funding. Therefore, I will be looking carefully at the budgets of these agencies, including the Law Enforcement Planning Commission and Government House itself, to identify monies that can be reprogrammed for this critically important purpose. Simply put, the Comprehensive Crime and Public Health Task Force has the potential to save lives and save scarce resources, and we cannot allow them to be sacrificed due to petty politics and the want of a few $1,000s. As always, I will continue to keep you updated on this important matter, and I ask for your continued support and prayers as we move forward to address the issues that impact us all on a daily basis. I'm Jeanette Millin Young, your senator, your voice, your advocate in the 29th Legislature.